take you back to 1982. So my name's Garratt. I'm a pharmacist. I don't work in pharmacy anymore because I don't have the time. My wife's a pharmacist and she keeps me honest. So, a couple of pharmacists in the family. Any other pharmacists here? One. Really interesting, isn't it? Yeah. So what I want to take you back to is 1982. 1982, which was just the year before I came, or 2 years before I came out of pharmacy school. Pharmacies were putting in their first computers. They were Commodore 64s. Now, in health, pharmacy was one of the first organisations to start transitioning from paper to electronic. Prior to that, everything was photographed and microfiched. You remember the microfiche? Yeah. Microfiches. So that's 1982, and we've come a long way since 1982. If you look at these machines here, this is what's available in pharmacy today as an example. So think about pharmacy. What does pharmacy actually do? Pharmacy, from a medical perspective, is about supply and advice. It's as simple as that. Sure, we supply products, we supply medicines to people, we talk to people about medicines, but that's the core of what we actually do. So, jumping onto Lance's point, which I think is really good, is the fact that I saw a GP 6 weeks ago. I spent an hour and a half waiting in the waiting room to see them. I had a 10-minute consultation. I took my script to the pharmacy. Half an hour later, I had my medicines, but I had to pop back the next day to pick up one item that wasn't there. So, is that good enough? I wouldn't take that from my lawyer. I wouldn't take that from my bank. I wouldn't take that from an accountant. I wouldn't even take it from my grocery store, but I accept it in health. It's just not good enough. So when we look at these machines that we have in pharmacy, because what we're all about is optimization of speed. So these machines are available today. This one here packs sachets. This one there then checks the sachets. So when it packs the sachets, this machine then has a look at the sachet to determine what's in that sachet. It photographs the sachet, it identifies all the drugs in that sachet, and if there's a problem, puts a QA label on it for the pharmacy to check, for the pharmacist to check. So I know a pharmacy last year with a few of these machines, and they put out 1.6 million sachets in 6 weeks. Okay, one pharmacy. Just remember, a sachet could have up to 9 medicines in it. So this one pharmacy tuned out about 10 million drug items in 6 weeks. Okay? That's the volume of what pharmacy can churn out, and this is what machines can do from within pharmacy. The key for pharmacy going forward, and for pharmacists going forward, is about automation, and it's about validation. So it's really important, and I'm really thankful from what we do in the sector that we have in New Zealand, the New Zealand Universal Medicines List. Absolutely thankful, because it standardises the drug data set across the country, which means I can talk English, and any other system that uses NZ-ULM, which eventually will be everyone, we can talk in the same language around medications, which means you don't have risk and you don't have errors around medicines. The second thing is these machines going forward, what they can do, if you look at this one, anyone here familiar with the blister packs? Okay. So, historically pharmacists would pack those, a technician would pack those. That machine makes blister packs. Okay, so it's all automated. So to give you a rough numbers, this one here, it's about 45 machines in New Zealand. This one here is about half a dozen. This one here is about 100 machines in New Zealand. So pharmacy is a long way down the automation pathway in New Zealand. This machine here is new into New Zealand. This machine here will pack vials. So you need to get your tablets and then a vial with a label on it. This machine will actually count the tablets, pop them in the vial and label it. Okay, rolling out in New Zealand now. This machine here, not available in New Zealand, vending machine. Why not? Why can't I get my medications or over-the-counter medicines from a vending machine? Is there a reason? Now let's just park the advice and whether it's appropriate to get medicines from the machine, but why shouldn't I from a convenience perspective? Well, what about this one over here? That one there will actually unit dose dispense for you based on a barcode from an e-script, the actual medicines that you want, whether it's an inhaler, whether it's the tablets, it's all there, and it's consumer facing. That one there is in the state, it's in a general practice, that one there. So you can actually see the GP, scan the barcode, and it'll pack and give you or label the medicines that you want. This is where medicine supply needs to go, and we need to move away from the traditional model where a pharmacist sits behind a counter, checks a whole lot of stuff and comes out and has a very brief word with you. That whole model needs to go completely in New Zealand, well, internationally. So the thing that is important to know is coming up over the next couple of years in New Zealand, there's going to be a plethora of mobile applications, and as we were talking before, there's hundreds of thousands of mobile applications in Android and iOS now. And these mobile applications are going to help support people to take medicines and know what they should take, when they should take it, have they taken it, and then communicate that information back to the new electronic health record, which we all hope will come into play, which means that information is then shared across all of the health providers. Because pharmacy collects a truckload of data, and in our system with what we do, not only do we collect supply data, we collect consumption data, so we can measure the difference between how much medication has been supplied to a person and how much has actually been consumed by that person. It's really valuable information for the GPs and for the secondary care, because just because I've given you medicine doesn't mean to say you actually take it. Who here has not completed a course of antibiotics? Case in point. Really important. And what did the GP say when they gave you the script? Make sure that you take these until you're finished, or the pharmacy would have told you the same thing. And yet we don't. So really, what does it come down to? Really in pharmacy, where is it going to be in 10 years from now? Pharmacists dispensing medications. To be honest, from our perspective, I'd say it's going to become a thing of the past. There's absolutely no reason why you can't have, Uber Ride, Uber Meds. Absolutely no reason. There's no reason why you can't have centralised packing, labelling, dispensing and supply from a central point out to anyone in the community by any means that technology will provide. Whether it's drones, whether it's courier, whether it's collection, you're picking it up, whatever, it doesn't matter. So I think in pharmacy what's going to happen is you're going to end up with a separation between supply and advice. So the supply is going to be one component of pharmacy services, and the other component is going to be advice and how you actually talk to people. So it's really important going forward, health literacy, absolutely critical. And the one thing in our pharmacy and me hiring interns coming through from university, new qualifieds, we beat the crap out of them to stop them talking technical, to get them to start talking in English to people in a way that they can actually understand. So I think the education system has to start looking at the quality and the type of person that they're training, because communication is far more important than clinical technical skills. And the reason for that is because AI and SaaS and web-based services are actually going to provide better clinical information to you technically than you can ever research yourself anyway. So what it comes down to how you communicate that information. I'll give a good example from a friend of mine who's a specialist, and excuse the language. Talking to a particular person on a ward, asks the person whether or not they had a bowel motion today. And they said, what? Have your bowels moved today? They just, from a health literary perspective, they didn't get it until he said, have you had a shit today? Yes. So the issue was the specialist was targeting the language appropriately to the person based on their level of health literacy. It's really important, really important. So it also comes as no surprise that patients do dumb things. Okay, classic example, person turns up pregnant in our pharmacy, this is a few years ago, queried on how it was all going. They were a little bit upset. Why were they upset? Because they'd taken all of their oral contraceptives on one day because it made it easier than taking one each day over the next 3 months. Very unwell. But the issue is that's our fault. Okay, that's our fault for not communicating and taking the time to ensure that that person understood really carefully. We've also all heard the stories around the person that used the suppository without removing the wrapper. Okay, it sounds funny, but the issue is again, that's our fault. It's our fault for not communicating. So moving forward, as technology advances moving forward, it's absolutely critical that not only do we the supply being one function, that we communicate appropriately. So technology can provide certain amounts of communication and information, but we also have to have that critical view where I understand the person that I'm talking to, and the person that I'm talking to understands what I'm trying to tell them. So where is it all going to be in 10 years from now? I believe that the education system, especially the tertiary education system, has to look at itself and look at what kind of graduates are being tuned out of the system now to deliver these services. The regulator needs to keep up, would be one of our functions. So hub and spoke supply, where you have centralised manufacture and supply of medicines out to community pharmacies for supply or out to individuals, makes more sense, but currently in New Zealand it's not legal to be able to do that. So we're really pleased, again, that there's a review and a rewrite of the Medicines Act and Pharmacy Act coming next year, which is going to enable a whole lot of different kinds of practice and behaviour within New Zealand. So I believe going forward, what's going to happen is there'll become a further distinction and split in pharmacy between the supply function and the advice function. You'll see the development of pharmacists becoming more attuned and more skilled in conversing and talking to people around what their medication is and what it is they're doing, casting a critical eye over what's actually happening with the medicines with that person, whether it's a review or just looking at the whole issue of you've got 4 medicines, and we always used to stop in our pharmacy and look at and step back and think to yourself, does this make sense? And sometimes just having that critical view is really important. But in pharmacy, you get busy with supply, and so you tend to be less interactive around the actual advice and consumption details that you need to impart to that person. How many people here have been into a pharmacy to pick up a prescription? They pick up a prescription and don't get any advice at all. It's an absolute indictment on the sector, and that the sector should actually not be doing that. Is you should be talking to someone about your medication when you come in, and that information should be granted to you. So I see it all changing dramatically. I believe that the whole way that pharmacy works today in 10 years will be completely different. I think it'll be driven by the consumer, it'll be driven by technology, and I believe it'll be also driven by the regulator. Thank you very much.